Welcome back, everyone. The cost of healthcare keeps rising here in Texas. A new series of reports from the policy nonprofit Texas 2036 called Symptoms of an Unhealthy Market point to higher prices, hospital consolidation, and billing practices for driving up costs for families and employers. Joining us now to talk more about this is Alec Mendoza. He is a policy advisor for health and economic mobility at Texas 2036 and is the author of 3 of the reports in this series. So, Alec, welcome back to our show. Thanks so much for joining us today.
For having me, Will.
I want to begin with a few statistics, so bear with me just a moment while I read out these. So, Texas families who get their health insurance through their employer pay nearly $27,000 a year for their premiums. Meanwhile, 63% have said that they delayed or skipped care in the past year because of costs. Those numbers really jumped out at us, so I'm curious to hear what you think about that and how it reflects the state of healthcare affordability here in the state.
Yeah, absolutely. What these numbers tell us are that healthcare affordability is becoming one of the defining economic issues facing Texans. When a family is paying $27,000 for health insurance and just coverage alone, that is a healthcare affordability issue. When that happens, those families are ending up foregoing care because 63% of those families are skipping or postponing care due to costs. And it is not just families that are feeling this, it is employers as well. Those employers are paying that share of premiums, and they're paying those instead of raising wages. What we are seeing is that state and local governments are having healthcare affordability issues as well. So this is touching everyone across the state. And our reports really point out why. And the answer is that healthcare affordability is broken because our healthcare market is not functioning effectively. We believe that a healthcare market has 3 components. It is transparent. Families and employers are able to get the information that they need to make informed healthcare decisions. We believe that the second pillar is competition, that there is competition within our healthcare market. And lastly, there is accountability. Players in our healthcare system are accountable to the patients that they serve. And right now, Texas is falling short on all 3 fronts. And these reports really point out the symptoms of our unhealthy market here in Texas and provide the legislature options to address healthcare affordability here in Texas.
Yeah, I want to get to some of those policy prescriptions to address some of this in just a moment. But something that you all highlighted in the report was an issue about facility fees. That's what they're known as. So can you talk about what those are exactly and how much they can change the cost of just even a routine visit?
Yeah, absolutely. Facility fees are a great example of maybe a charge that families don't see until the very end. Say your child's pediatrician gets bought out by a hospital system, a larger hospital system. Nothing about that visit may change. The care may be the same, the office may be the same, the doctor may be the same, but more often than not, what changes is the price. And that's because these hospitals are able to charge a facility fee when they purchase these clinics. They reclassify them as hospital outpatient departments. And what they do is, and this is where the billing transparency comes into play, when employers and payers and insurers are trying to pay that bill, they see the facility fee charge and believe that service took place on the main hospital's campus, even when it didn't. It may have taken place off campus at one of these newly purchased clinics. And so when that happens, families and employers are paying more for routine and more often than not the exact same care.
So you've also pointed out hospital consolidation as a major factor that's driving up costs as well. Why would that be exactly? What happens when what happens to healthcare prices, I should say, when maybe there is 1 or 2 systems that consolidate in a local market?
Yeah, one of these, the hospital consolidation is impacting the competition pillar of our healthy markets. What we often see is that hospitals are being purchased by bigger hospitals. 7 out of 10 hospitals now report being owned by a larger hospital system, and that is up from 56% in 2010. And the problem is, in any market, when you have one player controlling the entire game, that often leads them to be able to charge whatever price they would like. There is no other competitor. There is no other option. And so here in Texas, what we are seeing is that 9 metro areas have just 1 or 2 health systems controlling their entire market. It is spread out across the state. It is in Abilene or Laredo or Corpus Christi. And it is not just happening in these rural areas, it's also happening in urban areas. Right here in Austin, we have 4+ health systems, but 2 of them control 90% of the inpatient care market. And so when that happens, competition shrinks, prices inevitably climb because these players are able to charge whatever price they would like. And that leaves employers and families with paying these higher prices and, frankly, less options.
Alec, I know that we could get into a few other issues that these reports really detail about what's driving up some of these costs. But before we wrap up the conversation, though, I really want to focus on what some of the solutions might be. It is one thing to highlight the problems, but moving forward, can you talk about what you and Texas 2036 believe the state could do, or at least state lawmakers could do, to try to address some of these things head on and help people here in Texas?
Absolutely. The good news is that we're not just highlighting problems within our healthcare market, we are providing solutions. And we've actually seen a lot of momentum around healthcare affordability here at the Texas legislature. The House has a newly created select committee on healthcare affordability, where they spent and have already had 2 hearings talking about rising healthcare prices and the drivers that are increasing those prices. The Senate also had a hearing earlier this summer talking about the exact same issue in the exact same way. And so I think we're seeing both chambers really come together to talk about healthcare affordability, and this is really becoming a bipartisan issue as well. At Texas 2036, our recommendations again fall under those same pillars that I talked about. We are advocating for more transparency within our healthcare market. Again, families and employers are able to get the information that they need to make more informed decisions. We want to see more competition within our healthcare market, entities actually competing against one another for patients and on prices. And lastly, we want to see accountability. The players in our healthcare system serving patients in a way that is actually in their best interest. And so all of these things are something that we're really wanting to see the legislature to address. These reports also include options for the legislature to consider to make sure that our healthcare market is working for families instead of against them.
And of course, we will have to see whether some of those suggestions actually make their way into bills and possibly even laws when the new session begins in January. So Alec Mendoza with Texas 2036. Come back. We'll have that conversation at that time. But thank you again for joining us and for writing these reports. They're very interesting to read. So thanks again for being with us.